Hi everyone, welcome to another episode of Rehab Revolution. I am your host, Dr. Samantha Ritz, PT, DPT. I am a physical therapist treating in the Dallas Metroplex area. I specialize in racket sports injuries, which is pickleball and tennis. And I am the owner and founder of Function Physical Therapy as of 2023. So today, my podcast and my YouTube channel episode are going to be a little bit about common injuries that we see in tennis and pickleball. Now, whenever I was in school for physical therapy, we talked a little bit about sports rehab. Because tennis is not as common in the States as it is in other countries, we don't really talk about racket sports all that much. So today I wanted to talk a little bit about racket sports specifically, some of the common injuries in these two sports, a little bit about the anatomy and the biomechanics of why these injuries happen and how we can help get them away or decrease the risk significantly for these injuries. So how we're going to lay it out a little bit today is I'm going to kind of introduce some of the mechanics and the anatomy of tennis and pickleball, the serves, the ground strokes, things like that, how equipment can also have a little bit of a role to play in these injuries. Then I picked 5 of the most common injuries that I see, and we're going to break them down a little bit more and talk about each of those individually, why they happen, what the injury actually is, and then what are some steps that we can take to prevent those injuries or decrease the risk in further use. So let's talk a little bit about anatomy. So if anatomy is not your thing, go ahead and skip the next couple of seconds. But for me, I think it makes a lot of sense if we can understand the puzzle pieces of why things happen. And that's what the body is. It's just a giant puzzle. Everything fits together incredibly well. Almost so well that sometimes the body compensates a lot more than we want it to. So we got to make sure that we're taking that into consideration as well when we're treating these injuries. So first we're going to talk about I just picked a couple of joints that are really important in tennis and pickleball. We've got the shoulder complex, of course, is what you're going to think of, and the elbow, what you're going to think of when you think of these sports. Also your knees, your hips, and your ankles. A lot of people think that these sports are upper body only. That's 100% false. If you're thinking about how we're driving power and energy in these swings and the serves, everything is from your hips and your core. You're using those abdominal muscles, you're using all those glutes, everything, that's where power is driven from. So if you're kind of new to these sports as a player, as a clinician, as a coach, make sure that you're thinking of tennis as a lower body sport. If you can understand that power is driven from there, then everything makes a lot more sense. And actually it's a lot easier to decrease your risk of injury because you're not trying to drive from the chest and the shoulders, which is when things start to break down, unfortunately. So let's go into each one individually. First, let's talk about the shoulder complex. So shoulder, you're thinking of that when we're serving, when we're hitting a forehand, a backhand, you're using your shoulder, but you're not using your shoulder for power. Your shoulder is actually your endurance joint here in tennis. You're using your shoulder at the end point of the power movement. It's the follow through, it's the direction. So you really want to treat the shoulder as a endurance component when it comes to tennis. That means rotator cuff is especially important here. We don't want to be loading the rotator cuff incredibly heavy. I don't want to be seeing a high weight, low rep. Here we're going to be seeing a little bit lower weight, higher rep, stability in every single direction, every single part of the range of motion, especially if you're thinking about what an overhead serve or smash is. You are reaching all the way up as high as you can, and then you're coming all the way through. So that's all shoulder flexion, all shoulder extension, a little bit of internal and external rotation as well, especially with ground strokes. So you want to make sure that we're treating every single aspect of the range of motion there. Endurance on the shoulder. Next, we have the elbow. So elbow anatomy, we're thinking about tennis elbow. Of course, that's what we hear all the time. Your anatomy and what tennis elbow truly is you have a lot of smaller forearm muscles in your arm. Now, all of these muscles actually attach to a singular point on the outside of your elbow. called the lateral epicondyle. So that's what's really causing tennis elbows. All those small muscles coming in and attaching to that point. So if you think about what you're doing with tennis, probably less so with pickleball. Pickleball is a little bit flatter, but especially with tennis, it's a lot of turning your hand, right? It's that we call it pronation and supination in physical therapy. But really it's just that closing, like kind of closing the door, closing the doorknob, things like that, opening the door. If you're using, like a screwdriver, it's the same mechanism. In tennis, you're using that a lot with the topspin. So when you do that over and over again, those muscles get really bulky, really tight, and that pulls on that point, and that's really what's actually causing tennis elbow. It's just an inflammation. Now, with pickleball, you're seeing it more with that repetitive force absorption with the paddle. Tennis, you get a little bit more give because you have the strength. Pickleball, it's just that flat paddle. So everything is causing kind of discomfort in that point, but it's a lot of small muscles that run in and attach to that singular point. That's why you can feel it right there. If you have tennis elbow, you can probably trace those muscles all the way down and kind of the top of your wrist, and it's still sore. Those are all involved right there. Now, next we have knees and hips. Knees and hips, you have to take care of this in these sports because these sports are such quick movements. Change of directions, backwards, forward, side to side, diagonal, backwards, diagonal. You gotta make sure you're taking care of your hips and your knees because this is what's taking a lot of the force. With courts have a little bit more of a give. You wanna make sure you're wearing the right shoes. Sometimes I see beginners, they come and they show up in cross trainers or running shoes. Now, some courts won't even allow you to play on them, especially if you have a darker sole because you're gonna mess up the court. Make sure you're actually buying court shoes because then your shoes can grab and it gives you a less likelihood of injury for either your knees, your hips, your ankles as well. If you were to slip and you just don't have the traction, I see that a decent amount, more than I would like to, just because people aren't wearing the proper equipment. Now with your knees and hips, if you're thinking about it, with tennis and with pickleball, if you're sliding, you're changing direction, you've got to make sure that you're challenging your stabilizer than your hips as well. It's kind of similar to the shoulder. Now hips, we're driving a little bit more power, especially with those big movements like the serve, or if you're really stepping in to hit a ground stroke or you're stepping in for a smash in pickleball, you want to make sure that your hips are steady and have great stability enough to generate power. What we don't want to see is we don't want to see compensatory mechanisms here in your hips because that can be what's starting to cause some faulty patterns. And then I start to see hip impingement in a lot of my players, or they start to use their back muscles too much. And then that's what causes lumbar strains, which we'll talk about actually a little bit later. So if you're not using your hips, you're not using your butt really, and your thighs, then you start to use your back too much. And that's when you start to see that lower back pain. So you gotta make sure that you're really challenging those hip stabilizers as well. Your shoulders and your hips are very, very mobile joints. Because of that, you wanna make sure that you're challenging the muscles and all of the connective tissue in those joints to make them strong, okay? Now in the knees, I see so many knee injuries in tennis and pickleball. I honestly think just because of the court, because you're hitting that court over and over and over again. And then it's also a heavy plyometric sport. So we're jumping, we're running. It's a very explosive, it's not like cross country where you're running for 2 hours and then you stop. Tennis is on, off, on, off, on, off. So you've got to be able to make sure that you can do that. So with knees, I definitely see anatomy wise, we've got to make sure that we challenge our hamstrings as well as our quads. Your quads are your thigh muscles and your hamstrings are the muscles in the back of your thigh. With tennis, I see people have really, really great calves and they have really great thighs. But what we want to make sure is that we're challenging the opposite of that as well. If you have a really, really strong quad and your hamstrings are nothing, then your quads are going to overcompensate, unfortunately, and that's what can start to cause some knee pain. So we want to make sure that we're challenging the hamstrings, those muscles in the back of your leg as well, okay? Then lastly, we have ankles. So some anatomy about the ankles. The ankles you hear all the time, ankle sprains, ankle sprains, ankle sprains. You sprain it once, and unfortunately, you're probably gonna sprain it again unless we take some measures here. So with ankles, because tennis is such a quick direction change of sport and there's lateral movements, frontal, sagittal, everything, we've got to make sure that those ankles stay strong as well. So with my ankles, especially with my patients who have these ankle sprains, I always want to make sure that we're challenging balance and stability and weight bearing. So if you're going somewhere and you're just sitting there and you're doing all these ankle motions, make sure that you're challenging it when you're putting your body weight on your ankle as well. Now, if you're acute and you just had an ankle sprain, I understand why you're not doing that in the beginning. But if you want to reference my episode a couple episodes ago, I think my episode 1, where we talk about the 4 phases of effective rehab. You have your beginning phases and then you have the end. Once we start to challenge that plyometric sport specific phase, make sure you're standing on that thing. You're challenging it on foam. You're challenging it on, there's something called a dynadisc, which if you know what a Bosu ball is, kind of like a blown up balloon. So really challenging the ankle that way so it's more reactive instead of just strength where you know what's going to happen. You want to make sure you have good reactive ankle stability because that's really what these sports are demanding from you. Okay, let's talk a little bit about biomechanics. So the mechanics of these sports, of how people are moving, why we need certain things to do the movements well, okay? So some of the things I want to talk about, first, we're going to break it down into the serving technique, racket grip, footwork, and kind of recovery equipment a little bit. So first, let's talk about serving technique. Now, the reason we need proper mechanics with the serving technique, this is one of the most complicated things that we're going to see in these 2 sports. Now, with pickleball, it's underhand. With tennis, it's overhead. So with tennis especially, you want to make sure, like I said earlier, you're driving from the hips. You want to make sure you're driving ankles up to knees, up to hips. And then we're using a little bit of rotation from your torso and a little bit in your back. And then you can drive through your shoulder and your chest to come through. Now, what I see is people try to start serving, if this makes sense, they try to start serving from the belly button up. So they create all their power from their abs and their back, and then they try to muscle through with the chest. Now, the reason this is not the best idea is because now we're generating all of our rotation and power through the endurance muscles in our lower back and our core. Your abs and your muscles in your back are actually postural endurance muscles. So they have an actual different makeup, anatomy and biology wise, that allows them to be endurance versus power. Now, when we start to ask these muscles to be our power muscles, it just doesn't mesh because that's not what they were built to do. And that's what starts to lead to those low back issues that we're going to talk a little bit about later. So you want to make sure you're starting from the ground up when you're building the power in your serve, because you do have those power muscles in your thighs and your glutes that actually start to generate power, and they were built for that. So that's the number one thing I want to talk about, is make sure when you're serving, you start from the ground up. Really make sure you're using your butt and your legs. If you're not, and you're like, oh, I do think that I'm using a little bit too much of my abs or my lower back or even just my shoulders. I even see it with some people, they start with chest up with their serve. Make sure you can, what I would recommend, take your phone, put it to side, record yourself in slow motion, see where you're starting your motion with your serve, and try to lower it. Try to imagine getting a little bit of bend in your knees and a little bit of jump on the serve first. It's gonna feel funky. Anytime you change your serve, I understand, I'm a tennis player. It's extremely hard to change your serve. But trust me, if you change it now, you're gonna save yourself so much headache in the future if you injure yourself from serving wrong. Okay, next we're gonna talk about racket grip. So with racket grip, you have several different grips. You have continental, eastern, western, semi-western. I'm sure there's a couple more, but these are the ones I see the most. With the racket grip, these are really important to understand because this is what's gonna help or not help you with tennis elbow or with wrist injuries. So what you wanna do with racket grip, there's really, in my opinion, whatever you prefer, whatever you were taught with, stick with, right? You don't want to, changing your grips almost impossible, especially the older you get. Now with these grips, make sure you understand grip size, grip type, and why you're utilizing these grips. Now, if you understand that and it makes sense and it feels good, great. Make sure you're not gripping your racket too tight. Sometimes I see that people grip them so tight, and that's what can lead to an increase in the risk of tennis elbow. Make sure, tennis is all in the wrist. You shouldn't be arming it. That's what I call it. Your arm shouldn't be huge because you're playing tennis. Really, it's all in the wrist flick. You want to make sure that you're light. It's almost like you're barely holding it. Your racket is your extension of you. You're gripping it so hard, that tension is gonna feel so heavy when you hit the ball. Everything's in the wrist, okay? Then footwork. Make sure, footwork with mechanics, so important. There's this thing we call a split step in these sports where your opponent is about to hit the ball. If you're a good player, you should be able to read off their paddle, their racket, what that ball is going to do. That's what makes someone fast, quote unquote. That fast person is already halfway there before that ball even comes off their paddle or racket. So when you're looking at that ball, you split step. Basically what that means is it's kind of like a hop. You bounce on both feet. That allows you to change direction safely where your foot is not getting caught in a weird spot. If you can imagine you're running and you just try to immediately change direction, it's a lot harder than if you set yourself and then you change direction, okay? So biomechanics, split step, huge. Make sure, especially if you're not doing that on volleys, that can get you in a lot of trouble. That can get you in those weird positions on the volleys because you're not split stepping and reacting. You want to make sure that you're going forward, always forward, okay? Forward to that ball. And then equipment. So we talked a little bit about grip. We talked a little bit about shoes. Now strings for my tennis players. With strings, the higher your string tension, the more control you're going to have. This is going to be for players who've played a long time or they have power already and they just want more control, more spin. Now, the looser your string tension or the lower your string tension, the more power you're getting from that tension. These are going to be, usually I see this with my beginner players. They want a little bit more power. They're not really worried about the control. They just want a little bit more speed, okay? So make sure you're understanding that as well. There's also different string types. I'm not going to go into that today, but that's something that you can look into as well, of what string tension, what string type would be best for you. Okay. So we talked a little bit about anatomy, a little bit about mechanics. Let's talk about some frequent injuries, what causes them, how to limit the risk factors for injury. So I want to talk about 5 I picked, 5 that I see the most often. So we're going to see number 1, tennis elbow, obviously. Then we're going to see shoulder injuries, which is a rotator cuff tears, impingement, things like that. Then we're going to see ankle sprains, knee injuries, especially patellar tendonitis, and then lumbar strains, which I was talking about a little bit earlier. Okay, first, tennis elbow. The real name is lateral epicondylitis, if anyone cares. Itis means inflammation, which is really what tennis elbow is. Like I talked a little bit about earlier, very common among tennis and pickleball players, really because all these muscles running to that point, the outside of your elbow, that's causing just that kind of repetitive pull, tension, which inflames it. That's really what it is. It's just an inflammation, okay? So causes repetitive gripping, wrist extension during shots, that pronation, supination, turning the door, like I said, poor technique, so incorrect racket grip. That's why you gotta make sure you know what you're doing. If you don't, get a coach, get a pro. They're gonna be able to break it down exactly for you why you should be using this grip versus this one, okay? And a poor hitting technique. So if you're gripping the racket too tight, a lot of times with my beginner players, they want to hit it like this versus, which if you can't see me, this means like if you were trying to high five someone straight in front of you versus trying to hit out from the side, okay? So with prevention and treatment of tennis elbow, we want to make sure, number 1, we have full range of motion. Like I said in my episode a couple of times ago, the phases of treatment, we want to make sure we have full range of motion. We want to make sure we have stability. And then we want to strengthen, but we want to start strengthening in that isometric range. Isometric meaning we're contracting the muscle, but we're not moving it, okay? So especially with inflammation with tennis elbow, we want to make sure we're starting here. The worst thing you can do is go get a TheraBar or a dumbbell and just start cranking away on wrist flexion extension exercises. You're just causing more harm. You want to start with holds, okay? Now, holds is going to be, if if you think about it, if you're doing like a wrist curl, you're gonna curl up. Let's say your hand is under a desk, okay? Put your hand under your desk, curl into the desk. You cannot move, but those muscles are moving. Then you flip your hand over. Now your palm is facing the floor. The top of your hand is touching the desk and you are extending up. You can feel those muscles. Usually that's a little bit more uncomfortable with tennis elbow because those are the muscles that are being affected, okay? Then making sure you have proper technique. So we want to make sure we have the right grip size. We want to make sure that we have the right string tension. Now, here's a tip and trick. For those of you who has tennis elbow, make sure you're using a dampener, a rubber band. I've seen it all. Also, a lower string tension, if it doesn't affect your game too much, a lower string tension will help reduce the effects of tennis elbow if you already have it. It will decrease the force absorption that your elbow needs to take because the strings will take it from you. Because what's happening if you're hitting that ground stroke over and over again, you're hitting that serve over and over again, that all of that force, all that tension is going right to your elbow through the racket. The lower the tension, the more your racket takes from you, and then you don't have to absorb that force. So just a general rule of thumb there. Okay, now I will say 3 kind of exercises, the isometrics that I was teaching you guys earlier, kind of going up into the desk. Also, if you follow me on Instagram, I actually have a video for tennis elbow that you can follow with all of the exercises written out for you. So you can go get that a follow. Also, grip strengthening exercises, so stress ball, anything like that. And then actually finger abduction, where you have your fingers all together. If you put like a hairband around or a rubber band and you go out against the rubber band. Like if you were a sock puppet and then you're going out, away. So you wanna make sure you're doing that as well, okay? So those are my 3 for tennis elbow. Now let's move on to shoulder injuries, okay? Rotator cuff tears, impingement. Man, I see now in the physical therapy world, we have changed the kind of the naming of shoulder impingement into this whole other thing. I won't get into it today, but I can maybe make an episode on that later. Impingement, why impingement happens. The shoulder is a very, very mobile joint. Because it is so mobile, we've got a lot of structures in that joint that are helping to stabilize it. A lot of space where things can get caught. And that's what happens with impingement, okay? So happens with overhead motions, with really, mainly I'm seeing with overhead motions in these sports that are causing these injuries, but could be from multiple things, a fall on an outstretched hand. There's so many things with rotator cuff. I will say with rotator cuff tear that you generally see that as more of an overuse injury where it happens over time and then one day it's just the cherry on top and then that's when all the pain and inflammation starts to really kick in. So causes overhead motions where we're not using the right technique. So again, a call back to earlier in the episode, if you're not using your legs, if you're not using your hips and you're using your torso and your shoulders only to drive the motion, it's going to cause issues. So make sure that you're really taking time to focus on sound form and sound mechanics here, okay? And then poor conditioning. You know, if we're not challenging the stability and the endurance in these shoulder muscles, what are we doing? Like I said earlier, with tennis and pickleball, we don't really need to be shoulder pressing, bench pressing a lot of weight. Now, if you want to because you like to, great, go for it. But if you're trying to get healthy for these sports, you really just you need low weight, low resistance, and high reps. And you want to make sure that you're doing the right form with these things, okay? Now, again, call out to my Instagram. I actually have a free guide that gives you the exact stretches and exercises you need to do for a warm-up and cool down for tennis and pickleball. If you want those things, go to my Instagram or go to my website. It's a free guide. Just click that and download it. And it's actually 4 to 5 things that you can do. It takes less than 2 minutes to really warm up that shoulder to make sure you're preventing the injury there, okay? So those 3 exercises that I would give you there is really just rotator cuff strengthening exercises, which call out to my guide. You're gonna see shoulder pulses, you're gonna see resisted external rotation, and something called dump trucks, which if you see it, you're gonna think that looks easy and you're gonna do it and it's extremely hard. And then we wanna make sure that we're also stretching overhead as well. I really like for this foam rolling, a foam rolling technique like child's pose, perfect. Also thread the needle as well, those are good things, working on that mid-back mobility as well. Okay, now let's talk a little bit about ankle sprains. So ankle sprains, they happen, I see it all the time. It's that quick lateral movement on the court, which makes you slide. When you slide, sometimes your ankle gets caught. Pop, there you go. I actually did this when I was in college, when I was playing tennis in college. But my reason was stupid. I was doing hurdles. I stepped on the outside of the hurdle, rolled that thing right out. Grade 3 sprain. Didn't want to take care of it. Swelled up incredibly bad. And now that ankle is always going to have issues because I didn't rehab it at the time. So don't be a hypocrite like me. Make sure, especially if you're doing an ankle sprain, if you get an ankle sprain, you treat it immediately. It's very, very important, okay? So causes, sudden movements, poor footwear, just like I was saying, make sure you get court shoes that support you. Please, 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 please do not be wearing running shoes or cross trainers on the tennis court. It is the easiest way to hurt your ankle because those things just aren't meant to slide. It's gonna grip that court and you're just gonna roll out immediately, okay? So prevention and treatment, make sure your ankle strengthening, like I said earlier, make sure you're doing it in weight bearing as well, not just without weight and not just band usage. Make sure you're challenging reactive stability with the ankle. Make sure you're wearing the proper footwear. And also, if you sprain your ankle before, I'm not usually a huge proponent of immobilizing, but an ankle brace, like a sleeve, maybe a little bit stronger than a sleeve brace, but it also helps a little bit if you have a history of recurrent ankle sprains. Not a bad idea just to put that brace on there. It gives you a little bit of peace of mind, a little bit of extra stability where if you roll out, you're able to correct yourself with the brace, okay? But I would rather you have strong ankles, and then that's why you don't do it, okay? So things I would recommend for that is, balance exercises, calf stretches. Make sure that you're stretching your calf. You can put that on like an incline board. If you put your toe up on the wall, lean in, that's a good calf stretch. Things like that for the ankle sprains, okay? Now, let's talk about patellar tendonitis, knee injuries. So patellar tendonitis, if you think about your patella, your kneecap, tendonitis, itis, inflammation, okay? We're actually talking about the connective tissue from your kneecap down into what you would call your shin, okay? Now what happens is this happens with lateral movement and jumping, which is basically another name for this is actually called jumper's knee. We're just requiring that tendon to do a lot of work. Basically, every time you jump, every time you bend, that tendon is the one absorbing all the force. So with the court, with a harder court surface, or with a sport that requires a lot of active plyometric energy, that's why patellar tendonitis happens normally. I see it with basketball, see it with tennis, really see it with anything, honestly. Especially in my younger kids, I would say middle school, high school, I see this a lot, especially because you're growing. And you're growing a lot in your legs. So that's why I'll see that in my high school athletes as well. Causes repetitive loading and poor mechanics. So make sure that you've got the right form. That's why form is so important. Sometimes it's easy to want to focus on the fun, fancy stuff, but if you don't have a good base and you don't have a good foundation, your injury risk just exponentially skyrockets. So you want to make sure you're a coach, you're a pro, if you're a player or a parent, you want to make sure you're challenging form, that form is perfect before we're moving on to the more exciting things. Trust me, it's worth it in the long run, okay? Now, prevention and treatment of this, we want to make sure your quads and your hamstrings, muscles in the front of your leg and the back of your leg are stretched and strong, okay? Now, I know that kind of sound kind of, what is the word I'm looking for? Like hypocritical, like to say that I want them strong but stretched as well, because sometimes people can think that you have to have one or the other. That's not true, okay? You want to make sure that they're strong in every single part of your range of motion. You want to make sure that they're not just tight and contracted, and that you're only strong in 5 degrees of your range. If you're strong in 5 degrees of your range, you will get hurt so fast, because that means the rest of your range has no power, okay? And then that means you're compensating. You want to make sure that you're mobile, you're flexible, but you're also strong throughout the whole range of motion, okay? So especially with patellar tendonitis, want to make sure your quads are looking good and your hamstrings. Hamstrings. You're probably going to have to start with isometrics on your quad, which is just the holds without the movement. Your hamstring, you'll probably be able to challenge a little bit sooner faster because they're on the opposite side of that injury. And you want to make sure that your calves are getting strengthened as well. A lot of people forget about strengthening their calves. You actually have a calf muscle that crosses the back of the knee, which is really, really important for generating power and energy, okay? Then you want to make sure, especially in the beginning with tendonitis, you're resting it, but you're strengthening still. Rest means active recovery. Now, active recovery does not mean going out and playing a 2-hour match instead of a 3-hour match, or playing line 3 instead of line 1. Active recovery means you're still moving, you're still challenging things in the right way, maybe more yoga, maybe more recovery, but you're giving those structures a little bit of time to actually rest from the inflammation, okay? This is when seeing a trainer or physical therapist would be a really good idea for them to be able to tell you exactly what you can do and you can't do, okay? Now, the last one we're gonna talk about are lumbar strains. I feel like this is such an important one just because, like I talked about earlier, if you're not using the right form and you're not using your legs to generate power, then you're using belly button up. This is when this happens so often. And as anybody can tell you that's had back pain before, even neck pain, it is incredibly uncomfortable because everything requires your back, everything requires your spine, okay? So this happens because of twisting, turning motions that you're having to utilize when you're playing tennis or pickleball, when you're going for the backhand, especially with the backhand because you're using more of a closed stance. Closed stance meaning your feet are cut off to the court in front of you. An open stance would be I'm facing the court immediately. A closed stance would mean I'm actually taking that lead foot and I'm stepping to the side and I'm closing my stance. What that requires me to do is use rotation through my hips to get that ball in front of me, okay? So, causes excessive twisting, excessive motion, and power generated through those endurance posture muscles in your back instead of in your hips. Then poor core strength. So if we're not using the right stability in our core, I can get in a whole nother video on this about pelvic tilting and proper posture, especially in my women here, then it's really easy to overutilize the muscles in your low back, and that's what's causing these strains, okay? Now, prevention and treatment, of course, core strengthening, cannot go wrong. And oh my goodness, if you are thinking that core strengthening is a sit-up, don't, okay? That is not what that is. Core strengthening is extremely specific. It should be extremely specific to what your weaknesses are. Your abs, you don't just have one layer of abdominals. You actually have multiple. You have your obliques on the side. You have your abs, which is what you think of. You actually have these stabilizing muscles in your back that are equally as important as your core to make sure your torso as a whole is strong and stable, okay? So with core strengthening, look into what a pelvic tilt is. If you need core strengthening, look up pelvic tilt, look into Pilates. These things are huge. Once you get that form down, everything that you do ab-wise in the gym gets tremendously harder, but you're actually gonna see results so much faster. It's really, really easy to cheat on an ab workout. All right, so then proper form, just like I said, make sure you're loading through your legs, not through your back, okay? And then flexibility. Make sure you're stretching those hip flexors as well. And make sure that we're using, like, again, child's pose, thread the needle, things like we did earlier for the shoulder would be equally as beneficial for the back. And you can see that a lot of these exercises kind of are beneficial for multiple things. So then you're knocking out multiple things with one movement. Okay, so those are the 5 things I see most often. Hopefully that helps a little bit of talking about common injuries in pickleball and tennis, why they happen, a little bit about the anatomy, the physiology, the biomechanics of why we need certain things to be strong power-wise and why we need certain things to be strong endurance-wise, stability-wise, okay? So, how can physical therapy help here? Generally, if you're having a really acute injury like an ankle sprain, you want to make sure that you're getting in as soon as possible just so they can check it out, make sure everything's good, give you the exact things to do, not to do, and then you're kind of on your merry little way in a couple weeks. Unless it's like a grade 3 sprain or something like that, okay? Now, a physical therapist can assess you. They build you a treatment plan. I say, honestly, the most common thing that I get from people is pain management. How do I manage the pain? What is safe for me to do? What is safe not for, what can I not do? And that's usually the education part is the most important, especially in these acute injuries. And then my patient is able to take that information and go on in the future if they don't need a PT. That's always my goal. I don't want you to need me forever. I want you to understand why things happen. And then now that you have the knowledge, you have that for the rest of your life. Why did it happen? How can I prevent it in the future? Why am I doing the things I'm doing in this progression of treatment? And then you're able to really treat yourself in the future. And so that's really my goal. That's my mission for my patients, is just to give them the tools and the knowledge to be able to prevent this from happening again. Really, that's the main thing. So I want to encourage you to stay active and to prioritize injury prevention. It's really easy to put it on the back burner when you have a small injury and then 2 months later, you can't ignore it anymore. But what happens is 2 months later, so much harder to get that pain down without really aggressive care. A lot of people don't want to do surgery. They don't want to do injections. They want to just do conservative care, which is great. I agree. But the longer you wait, the harder it is to do. Okay, so make sure you're putting yourself first. Get in ASAP. Okay, really, really, really important. And just stay active, stay healthy. It's all about longevity. You want your body to be healthy for a long time, not a short time. Okay, so thank you for tuning in. I really appreciate everyone who's been listening to these episodes. I hope that this is helpful and gives you a little bit of knowledge on how to treat these things, how to prevent them in the future. If you have any questions at all for me, comment below, message me on this platform. You can message me on my Instagram. You can reach out on my website as well, functionphysicaltherapy.org. I really appreciate everybody, and you have a wonderful day.